and today I'm going to ask her some questions on my career path because I'm going into nursing. You want to introduce yourself and tell us about your degree and all of the nursing stuff that you have done?
Yep. My name is Jessica Kirby, and I've done a lot of nursing. I started off being a CNA in 2005. Then in 2007, I got my associates in applied science, and then in 2009, I became an RN. And throughout my nursing career, I've done a lot of different nursing. I started off, like I said, in 2009. I was an RN. I immediately became like a weekend supervisor. So I did a lot of handling concerns, scheduling. I did floor work, obviously, on the days I wasn't doing the supervisor, filling in, helping on the floor, just kind of making sure the building ran smooth, usually. Handling admissions, anything that came up during the weekend. And then I did that for around 2 years, and then around 2011, they asked me to be a clinical coordinator for one of the rehab units. So I wound up moving off of the floor, doing what I was doing, and then started doing clinical coordinator, which is kind of like managing one of the units. So I had 20 residents that I took care of, and then all of the staff for that unit. And that was a lot of fun in a sense where you got to manage and make sure that everybody was taken care of the way that you wanted them to be taken care of. So that was a bunch of follow through. I learned early that you definitely have to keep up on everything and you can't let it get behind. So being organized, being flexible, being on time for everything, you just had to keep up with it. So you had to do assessments on the residents, make sure that all the admission paperwork got done, make sure that the aides and the nurses were doing their job. We had a bunch of audits that we had to do to make sure that that happened. And then one of the biggest parts that I didn't like was having to do disciplinary action. You know, if people were late or attendance, or if they had concerns from the residents, we had to go ahead and handle all of that. And then in 2013, so seems like about every 2 years, they had me do something else at the facility I worked at. I became an admissions nurse. So that was bringing people in, doing the admission contracts with them, kind of making sure they knew what they were getting into when they came. It was mainly rehab people, so we did a lot with wound care, people that had like hips or knee surgeries, residents that had strokes, heart attacks, diabetic education, people newly diagnosed diabetics. So we had to do a lot of teaching in that position. And then obviously we had to make sure that the medication orders were correct and making sure that like the admission orders from the hospital matched the orders that we put in the computer, or back then it was on paper, handwritten. Making sure that the doctor knew everything that there was about that patient as well, so that they were able to follow through. We had to do a bunch of different charting, and then obviously introducing the resident to the facility. And back then we had to tour them around the facility, showing them where the dining room was, where therapy was, how to use their call light, and so forth. That was actually probably one of my favorite jobs, honestly. Then in 2014, they asked me to be the assistant director of nursing, and that was obviously the most scariest job that I have done, because I am responsible for, well, third down, because it went the administrator, the director of nursing, and then me. So that was the most scariest job that I've done, because I was responsible for everybody. So that job I learned a lot. We wound up having to do their like job descriptions changed, so everything kind of got thrown in on that, where I did a little bit of everything. So I wound up doing infection control, and I learned a lot about that because I was having to deal with following through with the health department if there was anything going on. At that time, a lot of norovirus was going through the facility, so a lot of gastrointestinal upsets, and you had to report everything to the health department, who then had to turn that information to the CDC to follow through. Following people that had flu symptoms, so I had to do all of the residents and all of the staff and keep track of that every month. And then I had to go to infection control meetings. I also had to help with scheduling in that position. We did all of the quality assurance in that position, which you're documenting how many falls people had, how many infections people had, how many people would come into the facility, then go back out to the hospital, so readmission rates to the hospital. We had to do meetings for disaster management, disaster planning. So it was the 5th region where I had to go usually once a month, and I had to help do the policies for writing policies for the facility, where it came to what happens when there's a thunderstorm, what happens when there's a tornado, what happens when the power goes out, all of that stuff. So that was really interesting. We had to go to a mock disaster where there was a train explosion, and we had to go through different things where, what to do in this situation and how to handle things and how to transfer somebody from one building to the next and stuff. So there was a lot to that job. And then I only lasted about a year in that, because not that I didn't like it, I just would prefer to do something a little bit less of responsibility. I was working a lot of hours at that time, and I was only getting paid for 40 hours, and I was working about 60 or 80, so I definitely did not like that job with work-life balance. So then I became a discharge planner in 2015, and that is the opposite end of admitting somebody. This is sending somebody home. So this is making sure that their orders match their discharge orders from here, making sure their prescriptions are called into the pharmacy of their choice, making sure they have home care set up, any equipment that they need, so walker, wheelchair, if they needed home care, or unfortunately if they couldn't go home, we had to find placement for them. So sending them to another facility, or finding in-home health care, finding a family member that they could go to, that sort of thing. And then making sure that they had a follow-up appointment with their primary care doctor, their specialty doctor, and then making sure that they understand the discharge process and make sure that they understand what their orders are, what their medicines are, and so forth. And then in 2016 to 2018, I was a case manager at a different facility, and I did pretty much everything from all my other jobs, the discharge planning, the admission process, and then I learned how to do MDS, which is kind of the billing portion. You have to assess the resident and submit it to this material data set, and then all of that information, all the assessments, you pretty much go through their entire chart and make sure that we didn't miss anything for reimbursement purposes. Finding out when they had their vaccines, when they had any falls, pretty much from the day they get there. Then we have to do like 5-day, 14-day, 30-day, all the way up to quarterly, annual, and so forth. So that was a lot of reading and follow through with that job. We had to assess them for pain, depression, again, making sure that all of the staff followed through the orders. We had to build their face sheet, which is building all their diagnoses, making sure it's right for, when they go to the hospital, and making sure that all their shot information is in correctly and so forth. So building their chart, basically.
Instead,
I also had to learn how to do Medicaid applications. I did a portion of the social work, trying
what
to
time you
figure
gotta
out
leave?
If they're depressed, what medicine they need to be on, correlating with the doctor and so forth.
It's dead.
Then I had
It's
to
dead.
do insurance
Mhm.
recertification. So
Try to jump
when
it
they come
before
in on a
Alicia's
managed
car
care
went
insurance,
in
you
her car.
have to go through and feed through the chart and find out what's going on with them at that time, if there's anything critical, if anything that they can stay there longer, because the insurance company, I don't mean to say it like this, but they manage their care. So they tell us when they can go home. They tell us when they have to go to a facility in certain insurance companies if they're not straight Medicare. So that was a lot of information, interesting information, learning about that. And then we also had to work the floor and everything. And then now I'm just a floor nurse and I love it. I get to work my own schedule. I love the 12-hour shifts, the 36 hours a week, getting able to pick up when I want to, being able to spend more one-on-one time with the residents. This job consists of pretty much passing medications, doing any treatments, helping out on the floor, doing any incident reports that happen, drawing blood, following up with lab work, orders, assessments, and doing any therapy referrals that they may need. So.
Awesome. Let's see. Okay, so you just covered my next question pretty well. How long did you have to do schooling for?
So I'm not proud of this, but it took me a little bit longer than most people. Usually it's a 2-year degree, is when your LPN or RN program is usually 2 years. I had failed one of my first med-surg classes by a half a point, and so I wasn't able to go right through from start to finish for my RN, so that's why I had to do the LPN program first, and then I did the LPN to RN program. So it took me about 3.5 years to get my degree. That's start to finish with the program, and then I did full time for my prereq, so it was about 3.5 years.
Could you tell me a little bit about the different medications that you're responsible for passing?
Yes. We obviously, I won't be able to cover all of them because there are thousands or millions of medications, but we do a lot of cardiac medications, heart failure medications. So some of the blood pressure medicines we use are like Lopressor, Coreg, Clonidine, stuff that can help lower their blood pressure, or Midodrine raises their blood pressure if somebody has low blood pressure. And then obviously you want to make sure you're taking the blood pressure before and after and monitoring. We give diuretic medications to help pull the water off organs, helping them breathe better. We do blood thinners for people that's had a stroke, so Coumadin, Xarelto, Eliquis are some of them. I work primarily in geriatrics, so we have to monitor pretty much their whole body. So unfortunately, that's constipation, making sure that they're regular so they don't back up. So we give a lot of stool softeners, Senna, Docusate, Colace. I primarily work with dementia residents, so we have Exelon and Namenda for that. We have quite a few residents that have Parkinson's disease, so Cinemed is the big one for that. It helps with shakiness, dizziness, and movement for them. We give a lot of pain medicine, Tylenol, Motrin, and then if those medicines don't cover it, then they move on to the stronger stuff like Neurontin, Percocet, fentanyl, patches, those kind of things. A lot of times now we've been trying some pain cream therapies, so Sombra is a warm therapy, Biofreeze is a cold therapy, so a lot of that helps as well. On the opposite end of constipation, we have to give anti-diarrhea medicines. If they have an upset stomach, Gas-X, Mylanta, Tums, those kind of things, Pepto-Bismol. We have a lot of seizure medicine, so Dilanta, Keppra, and then making sure that the lab work correlates, making sure they're on the right dose. Cholesterol meds, respiratory medications, inhalers, breathing treatments, making sure that they can breathe okay. Prednisone is a steroid that's also used. If they're sick, we give them antibiotics. penicillins, amoxicillins. If they have a urinary tract infection, based on whatever organism grows, but it's typically Cipro or Bactrim DS. Vancomycin if they have a really bad infection. And then obviously we have to do peak and trough lab draws to make sure they're on the right dose. In my line of work, we have a lot of people that have depression, anxiety, so some of those medicines are Wellbutrin, Lexapro, Celexa, Xanax, Ativan, those kind of things to help them. We have a lot of residents that have fungal infections with their feet or fingernails and toenails,
We'll take her
so
car.
we have creams for those. Thyroid medicines, antiviral medicines, diabetic medicines, so insulin, metformin, long-acting, short-acting insulins. We have some residents with gout, so allopurinol, muscle relaxers. I could probably go on and on with that, but there's a lot of different ones that we give.
Covered my next question there too. What advice do you have for an aspiring nurse?
The best thing that I can tell you is to don't give up. It can be hard. Nursing school is difficult, but it's rewarding in the end because you get to do what you love if that's the career choice that you choose. Make sure you have your support system. Make sure that you try and find a study group that is similar to what your goals are. Some people don't like to study as much as others or so forth. The biggest thing that I wish I would have learned sooner in life is work-life balance. So, for example, all of my management jobs, I learned a lot, but I also feel like I lost a lot of time with my family and friends because I worked so much. And I was at work all the time, and granted, your work becomes your work family, but I feel like I lost a lot of time with my family and friends. Research nursing, figure out what kind you like, because there are so many nursing jobs, geriatrics, pediatrics, travel nursing, doctor's office, all sorts of them, ER, surgery. So figure out what you like or what you have an interest in and see if you can try working there. That's another big one. You have to have patience, honesty, trust, which you have everything. I think you're gonna make an excellent nurse. If you don't know something, don't guess. Always look it up because you just wanna make sure that you're doing the best thing for your patient. And for nursing school primarily, ask for help, volunteer for everything so you get the best experience, because it's one thing to learn about it in a book, but then doing it is so much more fun. So volunteer for everything. Over prepare, because it's better to be over prepared than under prepared, and make sure you get there early, because they always look for being timely and being ready for things.
Have you thought about going to the hospital at all and learning about during anything with this pandemic that we're in?
Yes and no. Where I work, we were able to volunteer to go to some of the hot spots I worked for Ascension. So Missouri had a hot spot, Chicago had a hot spot. They were paying very well to do so, like $100 an hour. But for me, I felt being safe and taking care of the patients that I have is more of what I wanted to do, but there are quite a few people that did do that. And for me, it just wasn't what I wanted at the time.
Last question, what's the biggest challenge that you've overcome being a nurse?
So my biggest challenge would be obviously thinking that I'm a failure when I failed the class, and something else that I'm not proud to admit, I failed my nursing boards the first time. I thought I was prepared. I studied a long time. But I also have pretty bad anxiety when it comes to test taking, and so I don't know what happened, but I didn't pass the first time, so I wound up taking a class. It's called the Kaplan class, and I studied and studied and studied and made sure that I could just read through questions and know the answer before I was even done with them, and so that was probably the biggest thing. And then, like I had already said, the other biggest challenge is wanting to succeed, wanting to do what's right for the company and do what people want me to do at work, but then trying to find that work-life balance was very hard for me because I kind of am a people pleaser is what I'm told, and so I try and do what everybody else wants me to do and not necessarily think about myself first. So that was another big challenge.
Well, thank you for coming here and taking some time out of your day so that I can ask you these questions and for helping me with my class. I appreciate it very much.
No problem, anytime. Thank you.
You're welcome.